I'm a veterinarian, sure, but I'm way more than that. I am also a tango dancer, a struggling but determined pie maker, and a mom. With IndeVets, I get to choose when and where I work. I create my own schedule and choose shifts at nearby animal hospitals that are right for me. Having that flexibility is exactly what I need to have plenty of time for all those other things that I am. Because I'm more than just a vet. Visit IndeVets.com to learn more and apply.
Welcome back, everybody, to the IndeVets Happy Hour. I am your host, as usual, Dr. Andrew Heller, DVM. I have a co-host with me today that is not Marissa Brunetti, unfortunately. She's just so busy. That woman is just so busy. But anyway, I have a great replacement today, and this person goes by the name Dr. Miguel Ortiz.
Hello, Andrew. Hello, all. Happy to be here.
Well, I'll just give everybody a little bit of background on Dr. Ortiz. So Miguel joined us in the Pittsburgh region back this past spring, and we call him one of our pioneers because he was the very first IndeVet in Pittsburgh. He's a graduate of Purdue Vet School, and he has gone on to achieve a Master's of International Development and Public Policy from the University of Pittsburgh. So he and I were actually chatting a few months ago now, I think, about this problem of access to care in the vet world. And I invited him to come on and just kind of school us a little bit on this problem. And he's done a lot of research. He's attended, some conferences and some seminars on this topic. And I thought he'd had a lot to offer all of us in this field. So, we're sort of taking a little bit of break again from our New Breed series. So we'll get back to that soon. Stay tuned. I think we're going to do Cavalier King Charles next. So stay tuned for that. It's going to be a really nice one. So anyway, so today, Miguel, we were just talking about the goal of this podcast episode. And you and I agreed. We really just want to let everybody in this industry know that this problem exists. So for some of you, you may not know about this issue. So we'll define that today. And then I think Miguel is going to tell us and show us what kind of work is being done right now to find solutions and how we can all together in this vet industry implement some of those solutions and achieve some real strides. Let's start off, Miguel. I mean, I don't know much about this. I know there's this issue. I feel this issue of access to care. Can you tell us a little bit about what this term means? What the major problem is here that we're going to discuss today?
Yeah, thank you, Andrew. Thank you for the kind introduction. And it's been wonderful being in IndeVet for the last 6 months or so. But this idea, this notion, the last 6 months of my work have kind of surrounded this idea of access to care. Most of us have heard about it and we feel it. Like you said, we feel it. But what does it really mean? And there's a lot of really good work. AVMA has a lot of really good publications. There's a famous Access to Care Coalition paper from Dr. Michael Blackwell that's out there. And we can certainly share references with individuals that want to follow up with it.
What we can do is we can put in the show notes some of these references. So I can basically just copy and paste them in.
For sure. But, just to put a number on it, we know that in our country, there's roughly around 20 million animals, 20 million pets that are living in poverty.
Wow.
These are going to be animals that rarely get to see a veterinarian, rarely get to have spay and neuter services, rarely get to have vaccine services or, any sort of interventive services that they may need throughout their life. That's a lot. Let's just sit with that for a minute and realize that is a lot. And we are in a profession where we're called to serve and called to help, and to realize that there's 20 million lives out there that we don't have access to. They don't have access to us. That's a stellar problem. Another way of thinking about it is that, in the United States, 40% of our population, across the board, don't have access to resources. They don't have access to, for example, $400 on an as needed basis, right? They just don't have it in the savings account to need it if, their cat becomes blocked. A dog tears an ACL, swallows a toy or whatever it might be. Those funds are just not there. And unfortunately, a lot of those individuals are probably going to also not have access to crediting services that can help save or to step in and work on that. So That's a large picture magnitude of the financial, the economic side of things.
Right.
And then we can layer on top of that the geography, the culture, the language, the multicultural, racial dynamics that lead individuals to not have access to us as a profession. Maybe we don't speak the language that you speak. Maybe we're not located in your community.
Right.
Maybe we're not representative of your identity, of a client's identity.
Yeah, and I've seen that firsthand. There are practices I've been to that serve a specific community of people. Like I remember there's one, I'm in Philly, and there's this one area where there are a lot of Russian-speaking people. And there's this one vet that I worked with that she sees like everybody in the community that only speaks Russian because she could speak Russian. Language barrier is huge.
Mm-hmm. Yeah. A lot has been talked about the racial disparity of our profession, right? We're 95% white or whatever the number gets put out there. And I think a lot of fingers get pointed to that when it comes to access to care. And there's a lot that can be unpacked there as to why that is and what trends are going on there. But when we're thinking about it from a point of analysis of just access to care, all the different things that we talked about, the geography, the language, the culture, the economics, these are all reflections of something bigger than veterinary medicine. They're reflections of our society in general, inequities in general, and that's okay. I try to not to get too bogged down on the status quo of where we are, but more so, where are we going? Where are we going to go now? How are we going to get things to be better for our patients and for our clients and for ourselves?
Yeah. And this parallels a little bit of the human side as well, correct?
I mean, absolutely. My time at University of Pittsburgh was in public policy. In my public policy work, I spent, learning about the world of health inequities in across the country. Mm-hmm. Communities that live next to highways are going to have significantly higher rates of asthma.
Yeah.
Communities that live next to a coal plant's ash pile are significantly higher rates of cancer.
Yeah.
Communities of color here in Pittsburgh, there's a very a detailed study about the health inequities that go from African-American mothers here in the pillar of health, in the shadow of a world-renowned medical center. We're still having those problems. And why do they exist? Why are they so pervasive? That's important questions.
You had written down here something to do with gender.
Yeah, gender. Well, our profession once was male dominated, right? And that's changing. Another thing to think about is that just as much as someone from a different culture may not feel comfortable coming to a veterinarian because they don't identify with them, maybe someone with a gender identity may not feel accepted in our practices. Gendered bathrooms, for example, or it's probably not a numbers-wise common issue, but I think it's a growing issue and something that we need to recognize.
Yeah, absolutely. And you mentioned diet.
Mm-hmm.
What do you mean by that?
So we look at access to food and food security and food deserts on the human side. We understand this concept. We can't have access to fresh food. Dog food and cat food diets are, I think, can parallel that, are increasingly inaccessible to a lot of the folks who can't afford vet care. Yesterday, I was asked to recommend a food, and I recommended a common brand. It was $70 for a bag.
Yeah.
Probably not accessible to a lot of folks. And so then what do? They go and they buy dog food for wherever they can afford it, whether that's a low cost or budget grocery store, or have access to treats that are probably not terribly nutritious. And so if you're in a position where you don't have access to, just like on the human side, if you don't have access to fresh food and you don't have access to those resources, you may have higher incidence of diabetes. You may have higher incidence of high blood pressure. You might have malnutrition. Mm-hmm. And same thing, I think, applies to the veterinary world. If we believe in the science of our diets and if we believe in the science of good nutrition, and we know that our pet populations don't have access to good nutrition, but have access to poor nutrition, we should expect the same parallels of poor health outcomes, which increasingly require more veterinary care, except we don't have a safety net of public health so that it's all going to be consumer based, meaning that if an owner who doesn't have a lot of money must then feed their dog poor diets and that dog has poor health outcomes, they're going to be caught in this cycle of then needing to have more vet care, and it just goes round and round.
Yeah.
Do we regulate it? Do we institute universal care, or do we establish health care for pets as a right? That's a long way off, and that's a heavy thing to unpack. But if nothing else, we can have a discussion of if our clients and our pets don't have access to wholesome food, we should expect to have problems that need to be addressed as well.
Yeah. When we first were talking about access to care, my first thought was vet shortages as well. And then from vet shortages, I also thought to myself, standards of care have risen, which made, obviously we were talking a little bit about costs before, go up as well. So, you're talking about vet shortages, and then you're talking about, gold standard treatments and things like that are just getting more and more expensive. Does that factor into this discussion?
Yeah, it absolutely does. I think we can look at it from a couple ways. First of all, gold standards are great. Our medicine is so advanced and so sophisticated, and we're doing such amazing things. Miracles of modern medicine, for sure.
Right.
But sometimes we get stuck with, if we can't practice the quote unquote gold standard, we're doing something wrong. And that's the pitfall that I think we need to be cautious about. Medical standards require us to do what a reasonable veterinarian would do in our place, meaning that, the gold standard is there. We can aim for that. But if we are put in situations where we have to practice outside of that, as long as we're being reasonable, as long as we're following medical common sense or general accepted practices, then it's kind of okay to do that. And the other point of that, the other side of that coin is, are we teaching our students to be able to practice outside of these things? There's a lot of talk out there right now about the current education of our future veterinarians. Super good, so high end, so specialized. But can we step into those places that need veterinarians, like less representative communities that don't have access to a veterinarian, right? Shortages of veterinarians. There's really good work being done out of Banfield. Dr. Courtney Campbell and his team, they've done an amazing job looking at veterinary deserts and actually defining them and mapping them. And it makes sense that that there's places where we're not going to have practices. And when we're educating the future veterinarians, if we're not teaching them to be able to practice in a way that can intersect with the places that don't have access to care, don't have access to all the finances, then we're going to be increasing this gap as opposed to closing it.
One thing I think about is the increasing costs of going to vet school.
Yeah.
I know from my own experience, my vet school loans are, astronomical. And that just means that when I go get a job, I need to make sure that I am being paid in a way that I can pay those back. And so that in turn trickles down to where I'm going to practice and where I can make enough money to support that. So, if I owe $200,000-$300,000 for student loans, am I going to go take a job in a poor community in the middle of nowhere where there's a vet desert? I'll never be able to pay back my loan. So it's a little bit of it's a vicious cycle.
Yeah.
The system is set up to cause these inequities and to cause these access to care issues. And until we address the underlying causes, which is something that I just said, I don't know if we're going to be able to solve it, right? The cost of education is driving the cost of care.
For sure. There's it reminds me of another JAVMA article on the multi-model multi-economic model of the profession, right? On one side, in the middle is the supply and demand and cost of care. How much does it cost for a regular person to take their dog to the veterinarian? And on one side is how much does the cost that they incur to attain that pet.
Yep.
And on the other side, how much it costs us to go to school, and then the market for our employment. And all those forces trickle down to the cost of a rabies vaccine and the cost of a veterinary appointment. So you're right. There's all these upstream parameters. One thing that I like to think about and potential looking at the future is the work that's being done in the food animal industry and the public veterinary services. There's deserts there, and they've been recognized for many years, and there's a lot of federal funded programs for loan repayment that can help with that.
Yep.
We don't see that in the deep metropolitan areas. We don't see that in our rural areas where we don't have access to care. But that would be a really neat and really interesting way to move forward, recognizing that access to veterinary care is as important to the general and national well-being as food animal practices and public services.
Yeah.
Not to take down from the importance that they have, but there's something to be done there.
You mentioned when we were talking about the goal of this pod that there are solutions being presented. There are people working on answers here that we can all get involved in. So what are some of the solutions? How can we begin to address the access to care issue?
I think three things that come to mind are new business models.
Mm-hmm.
Number one, so looking at it from different perspectives. Number two, a lot of social science work being done in collaboration with veterinarians on how do we effectively engage with communities that are underserved.
Mm-hmm.
There's a lot of really good work being done there. And then the third is, I guess I'm going to call it self-work, which is the notion that we need to understand how this impacts us and the impact that we have on this problem in general.
You mentioned that there are some nonprofits or some businesses that have addressed this. I know here in Philly, there's something called Emancipet. Have you heard of Emancipet?
Totally, yeah.
I think they are actually national, right? They're in Texas and in a bunch of different states. And IndeVets has actually been a partner of theirs for almost since the beginning when we started. They've been a great partner to us. And I know that they offer extremely reduced pricing for even surgeries like spays and neuters. I mean, I think they have like a flat rate of like $60 to $70 for any spay or any neuter, which is hundreds of dollars cheaper than what you can typically get at a full service vet practice. Their vaccines, I believe, are like $5 each, but you have to live within a certain zip code in order to get those services. Or if you live within certain zip codes, I think everything's free.
Yeah. I learned about Emancipet at the recent ASPCA Access to Care conference out of the University of Minnesota. And, their work is phenomenal. Just hearing what they do and how they're really elevating. They're not just doing it cheap, they're doing it correctly. And that, right. I think that was what stuck out to me, that they're helping folks with cost, but they're not doing it by cutting corners. They're doing it by being smart. And I think that was just awesome to learn about.
Now, I can say firsthand, I've done some shifts there, and no, they really do a good job. I mean, their surgeons are top notch. They do a great job. And honestly, I sometimes tell people that I know, I say, hey, if you want a good surgeon who does 20 or 30 of these every day with good protocols and you want it cheap, go to Emancipet. It's not going to be bells and whistles. They're not going to keep your dog for hours afterwards and monitor and all that kind of stuff. But in terms of quality of surgery, you're going to get a really good outcome there. They don't represent, the full service model. So if they see an issue, they'll actually refer them to another full service vet practice. They don't ignore it, which I like.
And also, I'm going to say liberating the concept of spectrum of care. There's a lot of stigma to that. Spectrum of care.
Yes.
Spectrum of care being, there's a gold standard that for whatever factors we can't practice inside that gold standard right now. There's a spectrum. There's choices that I can make. But we were hesitant. We were worried about litigation. We worry about professional ridicule, for lack of a better term. Not that we ridicule each other, but we don't want to be, stigmatized by ourselves.
Mm-hmm.
And Nationwide Insurance, you brought them up. They're doing fantastic work on providing evidence base behind these spectrums of care. They have an awesome pancreatitis study. They have a really cool ACL injury study. There's their Colorado State, I believe, parvovirus protocol, which really led the way in this many years ago.
Yeah.
And so inside the private industry, because we're a private industry, giving voice to the spectrum where we can practice, I think, is important. And going back to my comments on the future of education, teaching within the spectrum of care, I think, is also important, so that future veterinarians can continue to be problem solvers when that not everything's available. Not everyone has an ultrasound. Not everybody has tono. Those type of things.
And you come from a shelter background too. I know you did some work in the shelter previously, correct?
Yeah.
So what are the shelters doing to address this issue? Obviously, they rely more heavily on government budgeting, correct?
Yeah, exactly. Yeah. I was at a individual nonprofit, so not a federally funded shelter.
Okay.
So a little bit of a distinction there, but there's a lot of really good work being done out of shelters. I think animal shelters and nonprofit organizations are playing a very important role in improving the access to care. These organizations are kind of like the listening tools for the veterinary profession. They're on the forefront of collaborating with and receiving feedback from the individuals that need the help, which I think is really important. They're really listening to the individuals that are affected by this problem. The other important role that these institutions play is outreach and education. Oftentimes their mission drives them to go outside their exam rooms, outside the building, and get to the root cause of the problems. They're involved in disseminating disease prevention information. They're a source of resources and oftentimes a safety net for folks that need it. And then lastly, they're really leading the way in research and innovation, which is going to be critical to test the solutions and to involve communities and individuals in finding the solution to the problem.
Great.
But one thing that we can add that I certainly think is important to talk about is the 9 principles of community engagement and the quality of care, which came from Emancipet.
Oh, yeah. So they're the 9 principles of
community engagement. So Dr. Elizabeth Berliner at the ASPCA, and then several researchers out of Tufts, the University of Pennsylvania, just down the road from you, and a few others are working on a guiding document for 9 principles that all veterinarians, shelters, nonprofit organizations all should consider when engaging with communities that lack access to care. And this work is based out of the similar guidelines for the CDC when addressing communities in public health. So sort of elevating the veterinary profession to say, look, if you know that there's a community that doesn't have access to care, you can't just walk in there and try to save the day. Mm-hmm. There's a lot to be considered before you try to do this type of work, and they're working on those principles.
What are some of those principles? You don't have to list all 9. Any good ones?
Yeah, I think the first one is becoming knowledgeable, understanding the community, understanding the leaders in that community, understanding what the community wants. So sort of deep listening and understanding of what they need and what they want, respecting the diversity in those communities, not coming from a savior mentality, but from a partner mentality, mm-hmm. Committing to a long-term commitment as well. When working with communities that have difficult or individuals that have access to care issues, fixing one thing once is great. But if we disappear and we stop a program or we take that away, then we may be even worse off. So being committed to this type of work is really important too.
No, that's very important.
So let's see, that was, we talked about the new models, the new work being done there, talking about how to engage communities and how to do it in a conscious way, in a deep listening way. And I think the other thing that is important is for veterinarians and veterinary staff and veterinary technicians to recognize that this is hard and we have to take care of our patients, but we have to take care of ourselves too. My own journey with professional burnout, with emotional self-awareness, I think I was very, very informed by this problem and by the practices that I've been at. You never know when it's going to walk in the door. You go to work every day and we love our jobs and we love what we do. There's stresses for sure, but we don't know what access to care. We don't know what it's going to look like. We don't know when someone's not going to be able to afford something. We don't know what's going to be wrong with the pet. We can't schedule it. Yeah. I can't schedule it in my day. Between the hours of 2 and 3 when I've had my lunch and I'm kind of rested and I've got my afternoon coffee, I'm going to be chipper and ready to do this, right? It's going to show up at 8:45 in the morning, or it's going to show up at 4:50 in the afternoon when I'm not ready for it. And that's hard, and that's tough. And it may derail your whole day.
Absolutely. It's part of being a vet, unfortunately, and that definitely contributes to the burnout you're mentioning. So, we promised in our goal that we would tell people what they could do to get involved in this, or to at least incorporate some of these, some of this stuff into their daily practice. Where could somebody start?
Certainly, what can we do? How do we get to this? How do we solve this problem?
Yeah.
For an individual veterinarian, which I think is a good unit of analysis, a good way to look at it, individual veterinarian or individual technician or an individual hospital manager, down to the individual level, what can we do? That's where it can be most impactful for us and for our clients. Certainly being informed is number one, right? We'll share resources and things to read and, things to explore. And even just doing that, I think, can give us a different perspective. So certainly that's number one. Second, I think, is a recognition that this is hard for the staff, for the veterinarians, for the technicians, for the receptionists, and also for the owners. There's a lot of trauma that comes with this. It's hard to be in a room with a dog with a gaping wound and not being able to do anything about it, right? Being in that place and saying, well, yeah, I can fix it, but you have to have all this money, but you don't have this money. So either I fix it and I have to deal with the ramifications from the boss, or I don't fix it and, oh my gosh, what do I do? It's traumatic, and it has nothing to do with an individual not being smart enough or creative enough, and recognizing that it's hard, I think, is also really important.
Well, we would have, in some of the practices I've been in, we've had funds that we would augment from time to time, or people would donate, and that way, when we did come across a patient that really did need, certain care that wasn't necessarily going to be lifelong, we would be able to fund those types of things. So, maybe veterinarians listening to this can start a fund that allows, people who don't have the money to get care for their pets.
Yeah, I think that's super smart. And I think, you could even get wrapped up into your benefits package. As each veterinarian gets benefits, we can maybe start negotiating for $500, $1,000 in my benefits package as part of my contribution to my community, right?
I like that. That's it's like a pro bono fund.
Yeah. There's, we can certainly learn lessons from different professions and how they manage this and how they provide for their professionals. I mean, wouldn't we feel great if I knew I had a $1,000 bucket that I get to disseminate, no questions asked? Yep. But I mean, obviously, we don't want to be the gatekeepers to this either, right? We don't want to make it a personal decision. We want to help whoever, no matter what.
Yeah, but it's really relevant for us as IndeVets. We don't own a practice.
Yeah.
We are not associates at one particular practice, so we can't justify giving away free stuff, right?
Right.
But as IndeVets, if we had a fund, I mean, kind of like the Share the Love Fund,
yeah,
where we can make some decisions and say, hey, this is a worthwhile case to spend a little bit of my fund on, to spend a little bit of my share the love, I would call it.
Yeah.
Potentially we could do that. I think that would be a great place to start for us as IndeVets. And thank you for that idea, because I think we should go back to the higher ups and talk about that for sure. If we can do that as a company, maybe other companies will follow suit and do the same.
Yeah, for sure. And the last bit to add, I think it's important to be able for us veterinarians and even our teams to be able to communicate clearly with owners about the risks that they're facing if they can't afford X, Y, Z. If they can't do a diagnostic, if they can't do an x-ray today, if we can't, afford this treatment or this medication, okay, what does that look like then? What are the risks that we're taking? What are the contingencies that we can make to mitigate those risks? Communicating that well, documenting that well in our medical record is important, because that makes us feel better. It's scary to say, no, you don't need that x-ray, and then taking upon that sort of decision upon ourselves to say, oh my God, I'm going to stay up all night, because we all have. Does Fluffy really have an obstruction or not, right?
Yeah.
That's scary. And so we say, no, sorry, you got to take that x-ray. I don't care, because I need to sleep at night. Well, if we change that paradigm, if we change that conversation to a risk assessment communication, to a documented communication within the context of what can I do? What do I, a clinician, feel comfortable doing? What is my hospital capable of absorbing? And what is the owner's literacy, health literacy, and capacities to provide outside the norm care, outside the gold standard care? Working and practicing that interaction and communication, I think, is really important to be able to handle these type of cases and really make a dent at this problem.
Yeah, I think that's all really great advice. Well, I think that about sums up this conversation. So thank you so much, Miguel, for being here with me and taking Marissa's spot, the seat for the conversation. But thank you so much. I learned a lot. I think I'm more aware now of the issue, and hopefully everybody listening to this is as well.
Yeah, thank you, Andrew. Thank you, Marissa, for she's here in spirit. I can feel it. So
absolutely.
Thank you for offering this platform to be able to share this with everybody. And we'll send links, and we'll keep up the good work.
Absolutely. Well, we hope you enjoyed this episode on the IndeVets Happy Hour. Thank you for listening. Tell your friends, whether they're vets, techs, just the general public. And if you guys like us, leave us a 5-star review and make sure to subscribe so you can be alerted whenever we have a new episode. If you have questions, comments, or suggestions for future episodes, you can email us at clinical@indevets.com. And also, to learn more about us and how we're making VetMed better, head to indevets.com. That's INDEVETS.com. While you're there, be sure to head to our blog for the latest stories and tips from our doctors. Cheers.
Cheers, y'all.